Hello, my name is Dr. Adnan Ahmed, and I'm a consultant psychiatrist working in UK. And with me today is Dr. Abdullah Abbasi. Abdullah is a ST trainee in gastroenterology, also working in UK. And we are doing this session on the NHS Jobs application form. And this is on the request of a lot of IMGs who've been contacting us, both me and Abdullah, to have a look at their NHS Jobs profile. And we thought we might do a session talking about the common mistakes and going through different section of the form to see how it could be improved. So first of all, thank you very much, Abdullah, for joining me this afternoon.
Thank you for inviting me, Adnan bhai. As always, I'm sure new IMGs who are applying for jobs would greatly appreciate your effort and time, but thank you for inviting me as well.
A lot of IMGs who are completely new to the system, they might not know that NHS job, the importance of NHS job application form, because this is the thing when you're first time applying for a non-training job, especially, this is something that goes to your HR and your consultants, because we don't send directly, normally we don't send the CVs, but this becomes your CV and your introduction to the hospital. So it is very important that this is filled correctly and in a way that they can understand your skills and your commitment to that particular job. So Abdullah, what are the things you have seen so far in relation to the job situation and these forms?
So the first of all, the thing that I would like to say is that what people need to understand is that when you send a CV, that is your virtual presence and that is your virtual personality. People don't know how good or how bad or how excellent or doctor you are, or what are your problems or what are your positive aspects. They would only see what you present in that NHS application form. So it is of paramount importance, I would say. I think the first thing is how you approach that. The traditional way was you will make one application and you will send it to everyone and all specialties and hope that you are going to get an interview from somewhere. And I don't think that that is the right way to go about these things now. I've recently had some experience where I went through a few CVs with one of my consultants as well. I think the first thing that people need to do is they need to know which jobs they're going to apply for. That might be that someone has an interest in surgery, someone is particular about medicine, someone is particular about psychiatry, or you just want a first job, which is absolutely fine, which can be in any specialty. But you need to tailor your application very, very properly according to that job and give that job application a proper respect. So that's the first thing. With every job on the sort of right side corner or in somewhere in that job application, there is a section called person specification. So they are automatically giving you the language that they want to talk to. You need to open that person specification and see what they're expecting you to do. You might not meet all those person specification. No one does initially. But then at least you know which are the points that you need to highlight a bit more in your application. What I've seen in most of the applications is that people have done amazing work. People have worked very hard back as a foundation doctor. Sometimes even after that, they've got brilliant CVs. They have presented, they have done things, but they have not presented it in a way where their strengths are coming out. It is just a lot of information which is not organized. And I think that's what we need to talk about in different section about how people can organize these things and present it in a better way.
That's great. Thank you. So after you fill up your name and your personal information, then the first section they ask you about the previous jobs you have done. And with every previous job, there are certain questions they ask, but at the end they also ask that tell us about what were you doing in the job. So that section is also very important. And for my experience, I've seen people writing loads of information there. Like paragraphs and paragraphs there. So what is your experience on that session, and how should be written?
You're absolutely right. People write long and extensive paragraphs there, which I don't think fills the purpose because no one has time to go through all that information. So to briefly, the first thing that people need to do is, if you can, try to write it in bullet points. Okay, so 1 or 2 or maximum 3 lines and sort of in the bullet points precisely, and try to instead of saying that your work here, try to tailor your job experience and explain it in the language of NHS. Now that might be difficult for some people who are starting, understandably, but you can easily sort of talk to a few people or just do a bit of research to see how it works. For example, when I was a house officer back in Pakistan, which is equivalent to Foundation Year 1 trainee, I in the morning would do a ward round with my consultant and the registrar. Followed by that, I would do jobs. Sometime I would do clinics. Sometime I would do emergency. So I would do all these sort of jobs. Now, the way to describe all this is first bullet point is, as I said, doing ward round under supervision of my consultant, and followed by that, doing different ward jobs. Second point is chasing various specialties for their input, as well as talking to families and updating them about relatives. Then the next point, I was doing acute on-call in emergency medicine and involving in acute take of patients. So all these wordings and things are not lies. They're exactly what I was doing then, but you can phrase it in a way that things are getting done in NHS. And I know it's not easy, but do this in bullet points, but try to avoid repetition. What people do is they would write exactly the same thing for their medical rotation, exactly the same thing for their surgical. So try to tailor it by saying what are the common presentations, or, for example, if you're talking about surgery, talk about your theater time a little bit. If you're talking about psychiatry, talk about that experience, but try to give different qualities or different thing that you have got in every rotation, rather than repeating the same thing over and over again. So in this section, try to be precise. Don't write long paragraphs, bullet points, and try to tailor your language to the language of what they're expecting in job description. If you don't know the language of NHS, you can always read the job description and see what have they asked. Because if they've asked for certain person specifications and you're trying to match these person specifications already in your input where you're talking about your previous job, then that's your added advantage. That means that, you have done your hard work, you have done your due diligence, and you're talking about it already. So that's what I would like to say about this section.
But followed by this section, obviously, again, in this section, when you're talking about job, I've seen a lot of IMGs putting a lot of procedures saying that, they have done IV lines and they've done cannulas and all that. But in NHS job application, actually, there's a separate section for the procedures you have done or you have expertise in. So they always ask you how many have you done under supervision and how many you can have done independently. So this is a time where you can sort of talk about your skills. Specifically, as you said, if you're applying for a psychiatry job, your skill set may be very different from if you're applying for a medical job or a surgical job. Again, in this section, I always advise people to be honest, because that is something you need to be careful. You cannot claim things you haven't done, and then, you might be put on spot. You might be given a job based on that you have done all this procedure, and then you would ask to do one when you came to UK, and that might be, you might not be fair. So what is your experience around, and how should people write that section when they're talking about their experience, past experience of procedures?
So with procedures, you're absolutely right. Please do not mention your list of procedures in your experience of your previous jobs. So that's not the time or the right place for it, because there's a different section. Now, when talking about procedures, please, it's very important that everyone or most people who are applying for the jobs have done PLAB. So you basically know what are the procedures that are expected from you, which are all the procedures that you have done in PLAB. That is the basic level that is expected from you. Any procedures above and beyond are done at a certain level. For example, I've seen a lot of people talking about how they can do endotracheal tubes at an SHO level, how they can do central lines. Now, you might have done these procedures back home, but here there are very certain protocols about these procedures. For example, with endotracheal intubation, it's always done mostly by anesthetist in a very specific settings, and not all anesthetic consultants are even happy letting the registrar do. So it's a very, very specific procedure. It's not like how it is done back home. So you need to remove those procedures where you are deemed a bit too skillful, or someone will say, oh, this person has done endotracheal tubes, central lines, they might not be suitable for an SHO post. But be honest, but talk about the basic procedure. No one would expect you to do a central line on the first day. I've been a medical registrar, and apart from my ITU rotation, I've never done a central line anywhere else. You would rarely be expected to do a central line outside ITU or a theater setting. So no need to put central line, vascular catheters, or endotracheal tubes. And along with that, there is a section here about your previous degrees as well. I mean, different people would have different opinion, but people say IELTS as a degree or PLAB 1 as a degree or PLAB 2. I don't think PLAB 1 or IELTS or PLAB 2 is a degree. IELTS is just a language competency certificate, and PLAB 1 is a compulsory certification requirement. So that those are not degrees. Your MBBS, your MDs, your MRCPs, they might be considered degrees, but not PLAB, IELTS, because that leaves an impression that we probably don't understand what degrees are. And again, I don't say all this to be cynical. It's for improvement as well, because we made the same mistakes at some point of time, and had to do quite a bit of hard work to learn all those things. So this is what I would advise in this degree section as well as the procedure section.
And afterwards, there is a section on management of change, or audit or quality improvement projects normally go in there. And I think we were talking about that earlier, because, and I advise the same to my trainees or the doctors who are coming to UK. So after doing your PLAB, a lot of us, we don't really have the concept of audits or quality improvement projects back in home countries, like when I came from Pakistan. But we may have done some things which we can put in this section, or we can, if we haven't done anything, maybe we can start something while we are still in our home country and applying for jobs. And any advice on this particular section?
So the first of all, I think Umar and you and few other people have talked about audits and quality improvement projects quite a lot. And there's a growing concept in people who are doing about PLAB, because when you are studying for PLAB as well, there are sections where you might be asked about quality improvement projects and audits. So people know about it, and people should know about it if they are planning to work in NHS. Now there are two sections: either you have done it or you have not done it. If you have done it, please make sure that you present it properly. Just so the way to properly present it: have a title of your quality improvement project, then have two objectives of what you were trying to achieve, and then say what was the eventual outcome. No need to write about how enthusiastic you were or how keen you were. The fact that you have done an audit and you have presented it in this way already shows that you are keen. And even if you have presented in your department meeting, for example, we do audits back home, which we would just end up presenting in the department meeting, that's good enough. Talk about that, because that means that you did something, you concluded, and you showed it to others as well. So that's very important. Now, the second thing is, if you have not done an audit, now, instead of clearly saying no to this section, what I would say is, because now you have time, just start an audit. Start working on something, okay? And it doesn't have to be something majestic. Start with something basic: IV fluid prescribing, analgesia, anything that you feel that needs changing in your department. Start something and say yes to this point, and then talk about what you are actively doing. That is always better saying that I'm in the middle of doing this thing, rather than completely saying, no, I've not done this at all. So if you are applying for jobs, if you're working somewhere, just start an audit and say yes. And then say that this is what stage I am, because that shows that you're keen to do it. So I think this is the way to go about an audit section.
And then following that, there are some section around presentation, teaching, management of change, management and experience, and team working as well. And I've seen people putting different things in there, but a lot of people, the forms I've seen, a lot of people put a lot of buzzword in it. They're saying that I love teamwork, I've always enjoyed team working, but they're not giving any particular examples of their personal experience, how they've shown to be a team member. Same with, I think, when they talk about the medical students, a lot of people talk about that I teach medical students, but they still don't talk about the contribution there, because as you know that you can teach at a different level, and different kind of setting can be used, and I don't really find those explanations in these sections normally. What is your experience of these?
You're absolutely right. Now, I think that people who come from sort of any part of the world, teamwork wise, they have done a lot of teamwork without even realizing it. Literally every single day of working is a lot of teamwork. It's just about realizing it. For example, with teamwork, they can say, because a lot of times when you are working in a government hospital, when you're working somewhere else, you have got someone on your ward who does not have enough money to buy medicine, you collect a donation. That is teamwork. Teamwork means you have seen something, you have taken an initiative, and then you have acted upon it, and then you have brought up your whole colleagues together. That's what teamwork is. So that can be an example of routine work. Your colleague was unwell, they had to go home on a festive, they were unwell, you covered them. That is part of teamwork. You designed a rota for them. That is there are so many examples of teamwork that people do on daily basis, but just don't realize how important that is. So the way I would say is, again, see how a team works in NHS. In NHS, what role are you applying for? If you're working for an SHO, know that you will be on acute medical take. You will be working with other junior as well as senior members of your team, and see what experience that you have from before. Like all the small experiences that I mentioned can be a contributing factor that you can give an example. I've seen some people start this section with a quotation in inverted commas and talk about how keen they are and how excellent they are. But if you keep on writing those things, no one is going to read that. You start by saying that I'm a team player, but how? You need to show practical examples of teamwork. So that's what I would say, that look at your previous examples, look at your job role in NHS, and see what kind of teamwork that you can bring to your hospital or your ward or your department whenever you're starting. And I really like the example that you were talking about earlier. If you would like to share it now, the interview and the cake one, which was a brilliant example of teamwork. And I think that's excellent. That's how people should go about it, really.
So I was mentioning to Abdullah that I've been in an interview panel where a British candidate came, and she was talking about when we talked about the team working and how does she management experience. She started talking about that she can make really good cakes, and she actually in a portfolio have pictures of cakes and really good well-made cakes. And she started saying that she started making cakes for her friend for birthdays and all that. Then she realized everybody was liking her cakes, and she started to develop a business idea. And after being a doctor, she's also running a business on the weekends. She actually have a team of people who work with her, and they make cakes for weddings and big venues. And she's getting good feedback from that, and she also had the feedback there as well. But the way she was talking about it, it was coming across that she have all these skills to set up a small business, to meet the deadlines, to make cakes, and to work at a standard. And a lot of people are making cakes, but to work at a standard that everybody likes her and will give her good feedback, and she responds to that feedback and improves herself every time. All of these skills, all of this is for a cake making. But you can see that when you become a doctor or you become a trainee, all of these skills can be brought to your clinical environment as well. So this is what I'm saying. You can bring examples when we talk about a teamwork and management experience. You can bring out examples which are non-clinical from your life. And as Abdullah was mentioning, we do a lot of teamwork. And I remember even studying as a medical student, we were doing everything with my friends, and everything was the teamwork. I don't remember anything doing significant solo. So we have all done certain degree of teamwork at some point in our life, especially as a medical students as well.
You're absolutely right. And you just need to correlate that teamwork briefly, precisely. Again, don't need to write big stories here or paragraphs and paragraphs. Just briefly, concisely, whatever you have done, see what leadership or teamwork qualities you have got from there, correlate it in your job role, or again, going the personal description. If you open the person's specification or personal description, sometimes you will see that they're asking about these specific things. Some jobs actually say leadership or team management skills and exactly what skills they want. So if you use those specific words and correlate with your examples, then that's a perfect candidate, because they've done their work, they have read the person's specification, they've given an example, and they're correlating their examples with that. So that would be perfect.
And when it comes to medical education, that one of the things I've noticed that a lot of people focus a lot on medical students. A very common sentence they say that I've been teaching 30 or 40 year medical students, but again, they don't mention how this teaching was done. Was it a bedside teaching, or were you teaching them in a theater, or a small group teaching, or what were you doing? But I always say to my junior doctors that with medical education, you have to think beyond the medical students. And if you're working in home countries thinking about PLAB, or if you're medical students, you can take the medical education teaching to another level. You can teach the nursing staff as well. You can teach the student nurses. You can teach the people who are non-medical as well. And with COVID and our expertise with all the teleconferencing software, you can teach, you can take your expertise much widely.
Absolutely. And I think even when we're talking about this in this section, teaching bullet points, but specific. So teaching, if you've done medical students, as Nanbhai said, was it a bedside teaching, was it an OSCE teaching, small groups, large groups, bedside, was it on clinical examination, was it on practical skills, what exactly was the bedside teaching about? And if you have got formal feedback for that teaching as well, if you have got, that's brilliant. But even if you don't, then that's also fine. But if you've got proper feedback, that would absolutely be brilliant. So talk about your teaching with all the other people apart from medical students, and talk about the formal feedback as well.
And the section afterwards, it's a very important section called supporting information. So after all of this information, they ask you to tell them about the supporting information, which is a big section in itself. And in this particular section, NHS job, you can use headlines as well, bullet points, bold font as well. And this is a very important section, I believe, because when a consultant has loads of application, this might be the main section they may be looking to initially screen the application. So you must write this properly. A lot of people just repeat everything they've said. I've seen them copy pasting everything which they have said in other section again in this section. And I don't know what is your experience of how best to write it, and then I'll share some of my tips as well.
You're absolutely right. I've recently, again, I said earlier, with my consultant going through some application, and you can tell, because my consultant could tell me right just by having a quick look that this person has just copy pasted and this person has done some hard work about it, because no one had read about the hospital. Very little people have read about which hospital or department they are applying. And what were our needs. And you can, and some people, although it was a medical job, said that I want to be a surgeon, I'm keen a surgeon, and they would just copy paste. That's not the way to go about it. So the first thing I would say, supporting information, is avoid repetition. Okay, things that you have already talked about, don't talk about them. Second is, yes, you are enthusiastic, you need to talk about it here, but don't start with a quotation, or don't start with writing 2 full paragraphs about yourself only and your qualities, because again, by the time someone reaches at end of 2 paragraphs, they've lost interest. This is the section where you need to show what you can bring to that team. For example, if it's a small DGH, say that how you like working in a close-knit team. And for example, if there is a one hospital, you say that you have read about that hospital in their A&E department, which has very good reviews, and you would like to be an active part of that team and would like to work with the registrars, and then correlate. So I don't want you to say that you're going to talk about all your job section again, but talk about your previous job experience in 1 or 2 lines and how that can be helpful here. For example, if you've done medical job in 1 year in your home country, then say that previously I have done extensive extended emergency department, seen patients with chest pain, pulmonary embolisms, COPDs, asthma exacerbation. And I think that that experience will be very helpful in my job role in this hospital. So correlate your experience with this job description. That's one thing. If you have got a specific visa, then that you can mention here. For example, some people are already here as a tier 2 dependent, or some people already are here. So if you have that, then that that might not be useful for everyone, but that's an added advantage for you. So you can mention that here as well. If you think you have got any other strengths, so I know few people who are very good with stats, they're very good with research and analyzing in those things. Talk about that here. Just very briefly in 2 to 3 lines, if you have got any other interest or strength. For example, if you like hikes, if you like to go out, those kind of things, you can mention that working in a rural small DGH hospital would really help me as well grow as a person because of this, because that shows that you have done your due diligence, you have looked into the place, you have looked into the hospital, you know where it is, and then you are putting a job application, and then say, in 1 or 2 lines how that is going to help with your career progression, that you would like to stay there for a bit, and then you will followed by that in sort of in a medical degree, or go somewhere, so that there is a proper correlation where they show that you have done a previous job in your home country, you know where you are right now, and you know where you want to go from here. So there is a proper order and a clarity in your application. So I think that's the way to go about it. A lot of people say, talk about their procedures all over again, talk about their audits and research all over again, talk about the previous experience. I don't think that's very helpful. And you should be precise, to the point, and just correlate it with the hospital or the job that you're applying for.
Yeah, I think the thing you mentioned about reading about that hospital and understanding the department and sort of mentioning that here is very important, because that shows that you have spent some time researching that hospital. And as Abdullah was saying, it's about understanding the job itself and sort of mentioning how, as a doctor, you are going to fit in that team, and also how that team will help you develop as well. So you're obviously everybody, all the junior doctors, when they're applying, they're always thinking about for the training post, or they're thinking about their career goals as well. So mentioning that is not a bad thing, to show them that you are actually very enthusiastic about a particular specialty and you want to sort of take that particular route. That will help as well. I just wanted to say this, all of the things we were talking about, this is my experience and Abdullah's experience on looking at the NHS job application. There's no one way of doing the application. People might do it in a different way and maybe more successful than what we are advising. So, this is just our point of view, and it may be good or may not be so right. So please reach out for other seniors as well who can look out for your applications.
And when I applied, I did not have most things that I talked about. The most of the things that I said you should not do in your NHS job application, I did all of them. I'll be honest with you. If I look back at my NHS job application, it would be very difficult for me to get a job, because at that time you don't know all these things, you don't know the system. But ultimately I did get a job. And if people keep on trying it, but you hear people talk about that because of COVID, there are lesser jobs than what they were before, which is true, because things are getting back to normal, but it will take a bit of time. So in this time, especially if you're eager and if you're keen and you really want a job right now, and you don't think you want to wait for 1, 2, 3 months for things to get even more better, then you need to do this extra effort. I mean, I think in medical profession, because doctors, wherever they go all around the world, there is always shortage of doctors. So we take these things just a little bit for granted. But if in other professions, if you see someone going for a job, you will see that they will prepare for it. They will have a nice CV. They will wear a nice suit. They're properly ready to go for that interview. And job application is a big thing. But because there is always shortage of doctors, we sometimes take this thing for granted. But that's not the way to go about it. We need to be due diligent, and we need to be really, really focused. And we need to put all the hard work into applying for these jobs.
And I think the other thing you already mentioned, and even if you are not in UK and you're in home countries, a lot of these things which are mentioned on the job, you can start doing them now. Whichever job you're working, if you're working in, a lot of people have this impression that a lot of good, nice things happen only in a big hospital, in a big city. That's not true. You can do a lot of these quality improvement things when you're working in a rural setting as well, or if you're working as a GP, whatever you're doing, you can always work towards improving your CV. You will always do courses online nowadays. You can always do things that will shine on your CV as well.
Agreed, 100%. And you because you don't need to be anywhere. You just need to have proper guidance, which you can easily get online these days. There are videos on YouTube. So many people have written blogs about it. So many people talk about it every day. So put in your effort before before saying that you can't do this. Make sure you have given it your full effort. And of course, it's you can give it your effort, and there's a matter of luck as well. But you can only blame it on luck, or you can say that it's circumstances or luck once you have done all your effort. So you need to first do all your effort and then see how things go for you.
Thank you very much, Abdullah, for joining me and all this good advice. I'm sure a lot of IMGs will be happy to hear all of these advices, and they may apply them on their next application form. And we are hoping that all of you are very best, and that you all get jobs and start your first job, and then move on to the training jobs like me and Abdullah did when we first came.
Absolutely, and wish everyone the very best of luck. I'm sure sooner or later everyone will get their jobs, but this will just be a process of starting your career in a very nice, very positive way. Because this does not mean even if you get a job by any method, this is just the start of the ladder. To be honest, there are so many more steps to go. This is literally the first step. So you just need to be positive. You need to apply all these things if you can, or whichever ones you can. I'm sure things will turn out good one way or the other. So all the best to everyone, and thank you for inviting me again today, Nandi.
Thank you, Abdullah.